So we are working on the progressions through patellofemoral pain syndrome. And what we're going to start with is weeks 1 and 2. We're going to start with the hip abduction, lateral rotation, slight flexion of the hip and knee and side lying. And that is what Kristen is demonstrating, also called clamshells. And she will do this weeks 1 to 2 with 2 sets of 20 reps with a 5-second isometric contraction. And as you can see, she's holding there. And then after we would do this one, you can also progress this by changing the resistance band, the Ther band that we have there. The next one we're going to do, which would also go into weeks 1 and 2, is we're going to do wall squats with 0 to 60 degrees of flexion. I'll try to move this down. So for this one, she would have knee flexion 0 to 60 degrees. And this would be weeks 1 and 2, 2 sets of 20 reps with a 5-second isometric contraction. And as you can see, we have a ball and she's going down nice and slow and holding. For these next ones, we're going to work into weeks 3 and 5.
Okay, so Ollie's going to demonstrate these. So the first thing that she's going to do is a step up and step down on a 20 centimeter step. So she's going to place her affected side, so her right side on the step, and she's going to slowly bring herself up, bring the left leg up, and then she'll slowly lower the left leg down, working on concentric and eccentric strengthening of the hamstrings. And then we can increase this by adding weights in our hands, like dumbbells, or just increasing like the amount of body mass that we include on it. And then we would have her do a lateral bridge here. So we're going to have her on the table, and she's going to be, okay, this is the ventral bridge. So she's going to be, okay, that's lateral.
Mm-hmm.
Okay, so she would do this, and then she would lower herself down, and then bring herself up into it. Right now she's just planking. She needs to actually bridge, so like go down. To like bring your side down to the table. Yep, so you're going to lower yourself down on the table, and then you're going to lift yourself up. So that's where we use those hip muscles to lower down and up, and she's going to hold it. And so then when we do the ventral bridge, it'd be the same thing. If we had to, we could start with her knees on the table, performing this, and lower yourself down, and then up, and we're just using those hip muscles to help bring the body off of the table. And like I said, we'd progress it to where she's up on her toes, doing the same thing, and then down, and then up. And these would all just be part of that patellofemoral pain syndrome progression. We would start with the hip strengthening because that seems to help these patients out a lot better than if we were just to focus on the quad. So we're going to incorporate all of these exercises.